All right. I'm Everett,
I'm Doug.
and this is our project on post-traumatic stress disorder.
Also called PTSD.
Yeah. So, you guys are in for a interesting ride.
We're gonna first have a video clip of what PTSD is and some signs and symptoms.
Yeah. So, hope you enjoy.
What is PTSD? PTSD is an anxiety disorder that can develop after a traumatic event that involved physical harm or the threat of physical harm. You might develop PTSD after experiencing traumatic events such as military combat, rape or sexual abuse, kidnapping or torture, a car accident or plane crash, a natural disaster such as a flood, earthquake, or hurricane. You might develop PTSD even if the traumatic event happened to someone else, such as a loved one. Sometimes just witnessing a traumatic event that happened to a stranger, as in the case of rescue and recovery workers, can lead to PTSD. If you have PTSD, you can't stop thinking about the traumatic event. You experience the emotions you had during the event, like fear or anger. These emotions get in the way of your daily life, work, and relationships. PTSD affects about 7.7 million American adults, but it can occur at any age, including childhood. Women are more likely to develop PTSD than men are. People who suffer childhood abuse or have other traumatic experiences are also more likely to develop PTSD. Susceptibility to PTSD may be genetic. Research continually finds new possible causes of PTSD. A small area of the brain called the amygdala, which may regulate fear, seems to work overtime in people with PTSD. People with PTSD tend to have abnormal levels of the hormones that respond to stress. The abnormal levels could cause extremely strong memories during a traumatic event. Later, these memories become flashbacks or a reliving of the traumatic event.
Alright, now that you know a little bit more about PTSD, we'll get into the history. So it had several names: shell shock, battle fatigue, accident neurosis, and post-rape syndrome. And then in 1980, it was given a formal name, PTSD. So up until then, it wasn't really one diagnosis, it was several. And then in 1980, it was given a formal name, so that way it could be recognized as a a syndrome or a
Disorder. And what makes PTSD so unique among other psychological disorders is something called the etiological agent or the external trauma. And what's so significant about this is that it's actually caused or develops from some sort of external stimulus instead of from some sort of internal weakness or flaw, which most of the other disorders are caused from. And something else that's important to note is that PTSD has been affecting human nature and human society since ancient times, because in ancient times references to PTSD were made in ancient literature such as the Epic of Gilgamesh and in Homer's The Iliad. Okay, so there are three main categories of symptoms for PTSD. The first being reliving, which the people with PTSD repeatedly relive the ordeal through thoughts and memories of the trauma. And these memories or thoughts can include flashbacks, hallucinations, and nightmares. And they also feel great distress when certain things remind them of the trauma, such as the anniversary of the event. Such things can cause them to relive the trauma. And the second category or symptom of PTSD, in order to kind of avoid reliving, is avoiding. So people will avoid other people or places or things that kind of remind them of the trauma, and this often causes them to be withdrawn and isolated and detached from their friends or family, and even can kind of induce or cause them to lose interest in activities that they were once interested in.
So that all kind of will lead to depression, and that can lead to substance abuse and other things like that, suicide. The last symptom, or last category, is increased arousal, which includes excessive emotions, problems with relating to others, which can include feeling or showing affection, difficulty falling asleep or staying asleep, irritability, outbursts of anger, difficulty concentrating, being jumpy, startling easily, and they may suffer from physical symptoms such as increased blood pressure, heart rate, breathing, muscle tension, nausea, and diarrhea.
Okay, so following up on these symptoms, we have kind of an interview with somebody describing what it's like to live with PTSD and kind of his account of things that go through his head with the disorder.
Having the dreams of being home and waking up and going, oh my God, I'm still here. That alone, I cannot. There is no words in any dictionary that I can tell you the feeling that brings upon a person. That is something that only another person that goes through that would understand that. The reality, that the dream that was so real. You were living, you were home, you were eating at Burger King, you were with your kids if you got kids, the family, in my case the beach, the beautiful blue skies, and you wake up and it's the same dusty place, the same shooting, the same helicopters, the same sirens, the same old Groundhog Day. In my downfall, my emotional breakdown, I tried to end my life. I don't remember it. I remember thinking that if I was willing to give my life up for my country, I was willing to give up my life for my family. And apparently I acted. I'm one of the many statistics, another statistic that I tried to end my life. I don't remember except having some pills in my hand. I know it was in my mom's house, which is a block and a half away from where I live. How I got there, I don't know. And I knew she had sleeping pills, but I had already taken all the Ambients that were given to me. So I was already in the ozone. I am one that I can't believe that I tried that because my religious beliefs won't allow me to commit suicide. But if someone like me can get to that, anyone can get to that.
Alright, so now we're going to get into the diagnosis part of PTSD. And PTSD cannot be determined through lab tests.
So in order to diagnose patients, doctors will usually send them to be interviewed by a psychiatrist or a psychologist. And the psychiatrist or psychologist will send the doctor a report kind of the symptoms. And the doctor will determine whether or not these symptoms kind of indicate PTSD or whether they indicate some other form of stress or anxiety. And if these symptoms continue for more than a month, then PTSD is diagnosed. But these symptoms that indicate PTSD can only diagnose PTSD if it goes on or continues for a month at least.
Treatments for PTSD are designed to relieve the symptoms and help patients deal with the traumatic experiences rather than avoiding it or anything that reminds them of it. Treatments help restore a sense of control to the patients and reduce the control the trauma experience has on them.
Okay, so there are 4 main types of treatment for PTSD. And the first one we're going to discuss is trauma-focused cognitive behavioral therapy, which involves carefully and gradually exposing the patient to thoughts and other reminders of the trauma. This therapy also aims to identify upsetting thoughts, particularly that are distorted or irrational, that are associated with the event or trauma. And the whole idea is to replace them in order to kind of create a more balanced picture or outlook on the situation.
The next type of therapy is family therapy, which is productive because PTSD affects not only the patients but the people around him or her. So interventions such as family therapy helps loved ones understand the patient's experiences. Family therapy also serves to solve any family or rational conflicts caused by PTSD.
And it also kind of serves to re-strengthen the family bonds because PTSD patients tend to detach themselves or isolate themselves from their family. Next, going into the medication aspect, medication is usually given to PTSD patients in order to relieve the secondary symptoms that follow PTSD, such as depression or anxiety. And the most commonly used medications for PTSD are Prozac and Zoloft. And it is important to understand that although medication helps patients cope with PTSD, it does not actually treat the causes.
The next and last type of therapy is EMDR, or eye movement desensitization and reprocessing, which uses elements of cognitive behavioral therapy with rhythmic left-right stimulation. So usually in the eyes, hand taps or sounds, which help to unfreeze the brain's information processing system, which is interrupted in times of extreme stress. And the video that we will be showing deals with this type of therapy.
Yeah, the guy we saw talking earlier about some of kind of the problems and whatnot he uses and experiences with PTSD. He's going to be actually talking about another sort of way he copes with PTSD and kind of one of the ways that he was treated with it.
What this meditation and vibration therapy is, it's using sound. It's not using any kind of chemical of any sort introduced into the body to get you to where your body naturally produces or goes into those states. It tells you in the recordings to use it for at least 30 days. I did that for 30 days, consecutive days, nonstop, 3-4 times a day. Each one, I would listen to the therapy of the morning therapy. During lunch, people at work were looking at me funny because I was walking around with headphones and this MP3 player hanging on my side, and that was immediately within a month, 2 months, people started noticing the difference. I quit having nightmares of being back in Iraq. I'm on no medications anymore. I don't suffer with the deep depression that I have been suffering with, which came and went. I'm myself.
Alright, well that concludes our video on PTSD. I hope you learned a lot.
Hope you enjoyed yourself.
And I hope you take a lot out of this video, understanding about PTSD and through the interview about what can happen and how people deal with it and some of the treatment options you can look into.
Yep. And that being said, we're done. Hope the rest of your life is great. And I hope you are really just inspired to go home and dig deeper into psychological disorders and really just dig deeper into yourself. I mean, we could all use some meditation and thinking over your life and really just learn to appreciate and not take for granted those who love you. I suggest you all go home and give your mom and dad and sister or whoever you love just a nice big hug.
And don't forget to give yourself a hug.
Give yourself a big hug.
It's a nice pat on the back.
Yeah. All right.
Take care.
Take care.